Thanks for joining us. At this time, I'm pleased to turn this over to Corey Sheehan, Director of Channel Marketing for ScanSource. Corey, when you're ready, take it away.
Hi, everybody. Happy Tuesday. Thanks again for everybody joining us today. So excited for today's session. I know we started a little bit late, but we've got a packed agenda, so I'll go ahead and kick it off. So my name is Corey Sheehan. I'm a Director of Channel Marketing here at ScanSource. I've been with the company for over 12 years, and I'm responsible for our go-to-market strategy within our communications and collaboration space. Also a graduate of the University of South Carolina, for those of you Gamecocks in the house. And our next speaker is Kyle Dewitt. Kyle is the Vice President of Technical Services, been with ScanSource for over 16 years, and is responsible for evaluating new technologies as well as building and delivering service offerings. Kyle's a graduate of Furman University. And then we also have two very special guests with us today, leaders in the healthcare space. Mr. Carina from Tribe 513. Chris is the Chief Operating Officer and joined Tribe family back in 2017. His primary responsibilities include the sustainable growth and operational success of Tribe 513's 5 divisions. He also has his MBA from Clemson University. And next up is Mr. Josh Thompson. Josh is the IT Director at Tribe 513. He's been in the IT profession for over 25 years and apparently loves Legos like my son, as well as virtualization. All right, so what are we here to talk about today? So today's agenda, I'd first like to introduce you to our Go Rto campaign. Then we'll talk a little bit about trends in healthcare, a return to panel discussion, technologies, and then some resources and wrap up. So before we get to the good stuff, I'd like to tell you a little bit more about our Go Rto campaign. So earlier this year, we kicked off a campaign or initiative to help our partners like you guys understand, right when COVID hit, how to help some of your customers move to working from home, right? And so obviously a lot of businesses, including healthcare, are looking to kind of get back to the new normal and help to see what that looks like. So this initiative is really designed to help you guys, help your customers understand how to help get some of your customers back to the office, right? And so we kicked this off last week with a really good discussion on education. This week we're talking about healthcare, and then next week we're talking about the general office. So love to talk to you more about that campaign, but no, we want to get started. So I'll go ahead and turn it over to Kyle to talk about some of the trends in healthcare.
All right, thanks, Corey. I think you did yourself a disjustice there on just the love of Legos in that household. I appreciate you changed your background today, but normally those of us at ScanSource that work with Corey get to see lots of them in her Zoom background or Teams background. So thanks for the introduction. I'm really excited to get into the panel today with Chris and Josh to talk about Tribe 513. Before we get there, we want to do just a little bit of level setting on the types of trends that we're seeing in this space. And we know our partners join these calls because we and our suppliers mutually are trusted advisors for them. And so this is a great opportunity for us to tell you what we're experiencing and what some of your peers are experiencing, specifically what Tribe 513 is experiencing here locally. But also to help you understand ways that you can best address some of this digital transformation, or as Corey said, the transformation into next normal or new normal. And so we are going to try to use a little bit of a lens here, as Corey said in the intro, on returning to the office. And then the office in this case is literally a clinical office, or it could be a hospital. I mean, there's all kinds of different physical brick and mortar where healthcare is provided, that when the pandemic hit, partners and organizations like Tribe 513 were having to find a way to get to their patients instead of it being the other way around, patients coming in into the facilities. And so there's a lot of trends that we saw that kicked up in technology over the spring and early summer months. And then now, as we are all looking at possibly getting back into the office, back into our healthcare facilities, what other concerns do we have, or are the changes that we made in March and April long-lasting changes. And I think, as you'll see as we go through this conversation, that the answer to that last question is yes. I mean, it's a lot of the investments that we're making in delivering patient care are not just timely sells. They're not just because of this current pandemic, but they also improve the experience. So lots of things we can cover here. Again, I don't want to spend a ton of time here before we get to our speakers, but let's lay some of the groundwork here. Some of the trends we're seeing, obviously, healthcare is becoming a more competitive space. Healthcare providers are starting to operate more and more like small businesses or enterprises, where they're having to compete for customers. And as you'll hear when we get into the intros for our panelists today, Tribe 513 is a great example of a healthcare provider that is focused on providing a unique experience for their customers. But we in our space get mired down in talking about CX and customer experience all the time. And it's easy to think that CX and customer experience is a retail thing, and it's not only a retail concern. It's across all of the industries. So this space for sure has had its challenges. There's you can always find a study that supports the content that you're presenting, but we did find some good studies that were showing American Hospital Associations were estimating that hospitals would lose over $200 billion in revenue during the first 4 months due to not being able to see patients, not get patients into the facility. And not all of that is just procedures that happen within the hospital, but also all of their outpatient care. So that's one of the big concerns that we have in the hospital space, the big hospital space, but even small clinics and small practices have concerns around telemedicine, telehealth, how to connect to their patients. Again, bringing healthcare to the patient instead of bringing the patient to the healthcare. Lots of investments happening around that fill in the blank space right now. Recent regulation on how telehealth is billed for and coded. So there's a lot of evolution happening right now in this space. I warned Josh I was going to want to geek out a little bit on EMR, because electronic medical records are obviously have been a very key element to providing patient healthcare in the past. Again, patients have an opportunity to choose where their healthcare providers. The old archaic paper files was not conducive to allowing patients to go to the right healthcare provider because they couldn't bring that with them. Now they can bring EMR with them to wherever they're receiving care. And with that comes the obligation to secure that data. So no doubt that the healthcare industry has been a huge target for cyber criminals, bad actors in that space. With all this sensitive data out there, it's incumbent on any of us that are involved in patient records to secure those patient records, and not only just secure the patient records, but secure all the devices that are on the same network as the software that is securing patient records. So it's a nesting doll, right? So there's a lot to do there, and I'll get into some of the technology areas, specific technology areas, after we spend some time with the panelists and can talk about it there. But these are all areas that ScanSource can help our partners with, and not just trying to sell you a thing, sell you a widget, sell you a piece of software, but help you establish the right business practice and be able to talk to your customers that are in this space. So I will switch. I'm not sure who's running the slides there, but let's switch over to the opening for, oh, you're both running the slides. There we go. All right. So as Corey did the introductions, these are our panelists today. We've already introduced them. I'll have you guys come off mute here and provide a little bit more color on who you are and what you do for the company. But we have Chris Carina, who is the COO, Chief Operating Officer at Tribe 513, and Josh Thompson, who is the IT Director at Tribe 513. We got an opportunity to meet Chris in our run-through before the session, and he very quickly tapped Josh and said he needed a wingman for this, and so I'm glad to be able to geek out with an IT Director as we go through this. But Chris, why don't you start us off? Tell our audience about Tribe 513, what practices you guys are focused on, and then add that color that I alluded to earlier of how you guys make your patient care a unique experience.
Yeah, well, thanks for having us. We're certainly humbled by the opportunity and hope whatever we can provide will be helpful. Tribe is a primary care practice. We've been around for about 14, 15 years now. Started with just one little pediatrics practice in Five Forks here in the upstate, and have grown now to about 12 practice locations. We have Parkside Pediatrics is our largest division or practice, Rto Internal Medicine, Parkside OBGYN, which is about a year and a half old now. We have the Breastfeeding Center of Greenville, which is sort of the first of its kind lactation support for new moms in the upstate. And then we have Rto Aesthetics, which is just a more of a cash business, aesthetics service line. And yeah, I mean, we have about 350 team members now across our company. We have a support group of which Josh is a major player and a key leader for us, called our Tribe One team, and that sort of what you would consider to be our management services organization. We do billing in-house, obviously IT, credentialing, clinical informatics, and some other things that allow us to to do business. Healthcare is very complicated, rapidly changing, a lot of dollars in, a lot of dollars out. To your question about what is sort of our differentiator, I mean, I think especially here in the upstate, there's two things that set us apart. One is we're independent and we're a private practice, and much of the upstate market is employed by either Prisma Health or Bon Secours, St. Francis, and there are just not that many independent groups left, and I think we're definitely the largest primary care independent group in the upstate. But more so than that, I would say it's our approach to how we do what we do. Medicine is very common, so we always challenge ourselves to do this very common thing in an uncommon way, and that starts with our people. We aim to truly provide that over-the-top customer experience from the moment we design our practices and invest money in the physical environment, to the discipline and the rigor that we put into making sure that we actually have a sort of a joke, but it's also true that we want our company to be the most difficult place to get a job, because we are that intentional about the patient experience. We don't talk about being in the medicine business, we talk about being in the love and serve business. And so whatever that motivation is for you, if you feel called to loving and serving others and doing it with humility and grace, that we're a great place for you to work. And so to your point about customer experience being so critical, we talk about that all the time. We're in the customer service business, and to your point, it's also a very competitive space. So we have to be able to bring something to the table that others aren't. And being independent, we have the flexibility to be innovative in how we do that and responsive to the market. And it's a really timely discussion to talk about technology and the IT side of that, because to your point, I don't think you're going to be able to put the toothpaste back in the tube here in terms of some of these remote visits and things like that. So we're faced with the challenge of how do we continue to offer this over-the-top customer service experience, but also integrate some of these new remote patient-facing modalities.
Yep, great. I appreciate that, and again, like all the color on why you guys are unique in this space, and I think we as businesses and employers share that mentality of wanting it to be a place that is hard to get into. So I appreciate that. And Josh, it's a little unfair, not just in following Chris, but because you work for the same place, so you don't get to expand necessarily on the introduction into Tribe. But why don't you tell us a little bit about your role at Tribe 513, and then why don't you go ahead and start us off with after that, just what a recent challenge is that you've been trying to help Chris and others solve for as we've been getting through this evolution in patient care.
Yeah, so Josh Thompson, I basically started with Parkside about 7 years ago. At that point, I only had about 7 or 8 providers. It was still just Parkside, and then it grew from there to a partnership with Rto Internal Medicine, and from that was kind of birthed this Tribe 513 idea, and it just has been a steady growth. So we've had a challenge the whole time of being able to to pace our technology growth accordingly to make sure we didn't hit a wall, even in the face of a pandemic or some type of crisis, that we didn't hit some type of wall that just totally crippled us. So yeah, but just to add to Chris's stuff, I'm uniquely positioned because I'm able to help understand how to apply the technology to meet some of those customer experience needs and meet some of the goals that we have as a team. We're real big on our team being taken care of almost first. Customer experience is a great thing to put focus on, but if you haven't invested in your team and make sure that they're being the best person they can be, then your customer experience is going to suffer from that. So we're trying to make sure that we are putting our technology to use to make sure our team members have the best experience possible, whether that be utilizing the desktops, working with the servers, working with remote access, making sure those aren't pinch points or nuisance points for them, so they can then provide the best either patient care or billing service or whatever it may be. We want to make sure that we're keeping our service mindset with our team, because we're not patient facing. We're not the ones that's in front of the patient. Sometimes we'll get in there and help if it's a technology challenge that we can help with, but it's rare that we have that opportunity. So we need to make sure that people that are doing that for our company are equipped to do that well, and trying to eliminate technology as one of the hurdles that they have to deal with every day. We're trying to engage with my team and try to help them, coach them through understanding that we need to make sure that people are seeing the technology that they get to employ every day as a tool to help them instead of a hurdle that they have to overcome every day. So just making sure we're always in that mindset and, moving forward with that. But yeah, we've had to do a lot of preparation, with when the pandemic hit and we were kind of shut down. We had already had the opportunity, because we have a lot of providers that remote work already. Some team members that for special occasions, they need to be able to do remote work. We have remote triage nurses that do after hours. So we had to provide a platform for all those people, for a while, so that could be achieved. What we didn't anticipate was the overnight, hey, we got to flip a switch and we're sending most of our admin workers home in our billing and IT areas. And we've even offset or been able to send home some of our call center type folks, our communications team folks. So we were fortunate enough to have been able to create a platform for that remote work to already be happening, to happen successfully for a small portion, and then overnight it blew up. So the challenges that we faced were, how do we scale that quickly? And luckily we had already invested in some virtualization technology where we could, on a data center scale, spin up more resources for remote access, whether that be more, VPN tunnel connections, more access to remote desktop services, and we do that, through Microsoft secure channels as far as how that product is being delivered. So yeah, there was a lot of unique hurdles quickly, and then of course that was just to keep our team moving, but then we also had to keep our patients coming in. So that's where we had to make sure the telemedicine and all that, or telehealth for us, was rocking and rolling, and we had demoed that and made some progress and kind of toying with the idea of if this is the future of medicine, we want to make sure that we're able to pull that off. And we had to flip that switch pretty quickly. And it took us about a week to smooth out some kinks, but after that, we've had pretty good success with the televisits.
Good. Yeah. And you're playing the straight man very well, even though I didn't set you up with these answers ahead of time. But I love hearing that. IT investment should not be an inhibitor to growth for a company. That's making all of our partners super excited, because they're all going to call you after this and go like, well, hey, let me sell you something. But that's a great point. I don't think we've had a panelist bring that up in those specific words yet. Chris mentioned, we're providing a common service, but in a very uncommon way. And that has been across the board. It's not just this industry, it's other industries, for sure. And as we did our prep call with Chris last week, he mentioned MSO, and that you overnight had to send 90 people essentially home to work from home. And so just Chris, before I come back to you, Josh, I want to one, give you an out. Feel free to use all the alphabet soup you want, VPN, all that stuff. That means something to me. So, you don't have to put the kid gloves on for me. But two, just, you're a fairly small IT organization that had to make a very quick and very important decision around how to best use virtualization to enable your workforce, but also to make your workforce, collaborative and connected. So tell us a little bit about how that decision-making process went. Did you partner with somebody that brought you a solution that you implemented? Was it something you guys decided on and built in-house and then went and tried to find the right product to fit the need? Or plan C? What did that look like?
So we've always had fairly decent talent on board to help us pull some of these things off. So we knew if we had access to the technology, we would probably be able to get it implemented without having a lot of external resources. And we've always ran with the mindset of we would rather, use our dollars to leverage great technology with people that can manage that technology than to have to go out and just hire more people. So yeah, we do have a smaller staff, as far as managing the inside clients that we have, or our customers, our team members. But we've made sure that we have built ourselves on platforms that allow us to scale quickly with people that can manage those platforms instead of, having to say, oh, well, we're not using smart technology. We're doing stuff either an old way or a way that requires us to have more hands-on with each individual device. So it's about making sure we got proper device management in place. We've got proper vision into our mobile workforce. What does that mobile workforce look like in the future is one of the discussions that we've been having recently, where it's like, we've typically had admin or, billing office area, communication team area, and even some IT space that most folks come in and they sit down and they work and they go home. Well, in a world where that is now a challenge, we have to look at moving forward. We probably need to mobilize our entire workforce. So we're kind of taking a stance to shift gears to, unless there's a specific need for something to be a stationary piece of equipment for, computing, it's probably going to be a laptop, and it's probably going to be set up with some, mobile management, stuff like that to help us to do that type of stuff.
Yeah, we didn't even talk about MDM. I'm glad you brought it up. All right, I feel like Chris is left out over here. So
no, this is great. I'm learning.
Chris, I'm gonna just throw up a token question for Chris, and I'm gonna come back to you, Jeff. No, Chris, we talked a lot about, again, going back to your comment you made a little while ago, just about providing service in an uncommon way. You had mentioned to us that it wasn't necessarily overnight, but it was very quick. You guys had to make a decision on how to provide curbside healthcare, and I think you mentioned that you were literally out there after a Sunday afternoon meeting, setting up tents, and to Josh's point, trying to bring mobile devices into the parking lot to provide some care. So why don't you give us a little bit of info on what you guys did, what you were able to implement, and how prepared you felt like you were on that Sunday afternoon to make it happen Monday. Yeah,
thanks. Boy, it's a great question, and it's a situation that continues to unfold really every day. The whole nature of COVID being so unpredictable. You have to remember back when this first hit, we didn't really know what it was. We didn't really know how it was spread. And so as a medical provider, you're really looked to as the quote unquote expert, right? To set the bar. And so we were feeling a lot of pressure to figure it out. And so the short answer of this, which is saying something for me, but the short answer of this is that we put a task force together that we basically implemented a 3-stage solution. We said, hey, stage 1 is when the news started to really talk about this is going to not just be an issue in Wuhan, China, or in Italy, it's going to come to the States. Stage 2 was when it was in South Carolina. And then stage 3 was when it was sort of where we are now, which is a widespread pandemic. So fortunately, we had enough smart people at the table to tell us this is going to be a stage 3 issue. Let's be prepared for it now. And so we started some discussions. Josh was a member of that team. We brought our operators to the table. We brought some of our key physician leaders and partners to the table. And we just all sat there and we put our titles aside and we said, let's, no ego, let's throw ideas out there, even if they sound crazy right now, because you have to remember for 14, 15 years, Tribe's done one thing really well, which is in-person patient care and providing that sort of the Disney or Chick-fil-A experience, if you will, as soon as they walk through the door, so that they don't feel like they actually went to the doctor's office. They feel like they just kind of came in and were part of a family. And that all got thrown on its head overnight, because all of a sudden, we had to, the first thing we were deciding was whether or not we want to have even test for COVID at all, or whether or not we just wanted to say, if you have COVID symptoms, you got to go somewhere else. There's some big systems in the area. And we felt like this is the profession we got in. If we can test for it, we need to do our part, and which puts a lot of non-technical things, but you have to get all the PPE and all the stuff that we've not needed before. So we needed to stand up some supply chains there. And then all of a sudden, the more you heard about it, it was, oh, well, it's airborne. So we can't test for COVID in our offices. So what does that look like? So that was when we just said, let's do curbside care. Let's care for people in a way where they drive in, they park in under a covered tent, and they never get out of their car. And then I think the last iteration of that was telehealth and televisits. And the reason why that wasn't first, because you might wonder, why wouldn't you do that first, is really because you got to remember in healthcare, so much of what we do is driven by what the insurance companies pay for. Up until this point in South Carolina, telehealth, which is provider to patient, just like I'm doing here, a virtual visit, was not well compensated. It wasn't paid for very well. And so it's not a viable solution. If I took 50% of my volume on a daily basis, so for a pediatrician, that might be 30 patients a day. If I took 15 of them and did them on virtual visit and only get paid 10% of what we normally do, we're going to be upside down pretty quick. So the biggest thing there was all the payers started to reimburse us at the same level that they do for a normal office visit, which made telehealth overnight, that's what Josh is referring to, extremely viable. And so that's when I turned to Josh and I said, Josh, I am so sorry. You got a crack team of 4 or 5 people. This is going to be, it literally was working around the clock for them. Our EMR, I know you're going to talk about EMR a little bit. Our EMR, eClinicalWorks, had a telemedicine, what do you call it, Josh? A module or yep. Already in it. We just never turned it on because we never needed to. And so God bless Josh. He was literally working around the clock. We turned it on. We had connectivity issues. We had calls dropped. We had all these things, and they just didn't. I don't know that he slept that whole week trying to get it figured out. But when you think about curbside care and telehealth and all these things, curbside care still needs Wi-Fi. You still need Wi-Fi. Silly things that maybe don't seem huge in the grand scheme of things make it possible for us to be able to do this. And to your point earlier, meet people where they are. And with us being a primary care, we have pregnant moms who can't do virtual visits. That OBGYN needs to be able to come in and check, and actually put their hands on the patient. You have newborns. You can't do virtual visits for newborns. So, and then you have our internal medicine, which has, adult, seniors, geriatric patients. They all need something different. So all of these solutions we had to sort of cobble together to where we could meet people where they are and provide care in the most appropriate way possible based on their circumstances. And it was a true team effort. And like I said, it's not done. Now as we talk about what does it look like as we get past this and try to get back to normal, whatever that looks like, I've kind of thought about it, not to be disrespectful, but I've thought about it a little bit of like 9/11, where, you can still fly today, but it looks different than it used to before 9/11. Before 9/11, you could walk a loved one up to the gate. Well, you can't do that anymore. What is that going to do to medicine? What's going to be sort of that 9/11 impact on medicine? And so I've said before, we don't want to build a blockbuster practice in a Netflix world. And so one last thing I'll say is, we are actually in the process of designing 2 new facilities, one for Parkside and one for Rto. And we've actually factored in some of what we've learned through this into the design and changed that. We've reduced our waiting room size because I don't think people it's going to take a long time before people want to sit next to somebody else without some skepticism. God forbid you get water stuck in your throat these days and you get a little cough, everybody kind of looks at you like, yeah, you have it? You got the Rona? What's going on? So we've got all these things we have to deal with. We're factoring in telemedicine space for our providers into the design, and probably going to have some elevated curbside presence that will be a permanent part of our offering.
Yeah, I was gonna do a call back to that just as we start to look at what kinds of investments we're making now, whether or not you think they're going to be persistent. But maybe I'll just have you say it again. I'll ask the question maybe you've already answered, but do you feel like curbside patient care is going to be required by your patients in the future?
I do. I really do. And I think our ability to deliver that is one of the differentiators that we have as a, I don't want to say small, but as an independent practice where we don't have layers and layers of bureaucracy. So we can get in a room, we can make a decision, we can pull Josh and his team in and say, hey, what do we need to do? And that's one of the best things about working with Josh is not, and I'm not saying anybody on this call is, but I learned in my MBA program, they're like, you don't need to know what your IT director knows, but you got to know enough so that they don't just get all the most expensive toys in the world, because there are lots out there. Josh has never done that. Josh puts to his point, he puts our team members' experience first and then our patient experience right after that. And those two things are so often linked that I can go to him and say, Josh, this is what we want to do. You tell me what we need to do to make it happen. And then he goes and his team just does an amazing job implementing. But I absolutely think it's going to be a demand. Convenience is here to stay. One thing we didn't talk about that's only been around for 2 weeks is we started doing curbside check-in, where people can check in when they pull up. They don't even have to go in the waiting room. They get a text when they're ready and they go right back to their room. So they never really have to share space with other patients. So those kind of things are, they don't need to be COVID related. Those can be things that can innovate healthcare, make patient visits more comfortable, make them faster. Nobody likes sitting in a waiting room for 20 minutes with a magazine that's 3 months old, right?
Yeah. Well, Josh, I'm not trying to create friction here, but I'm going to ask you a question, even though Chris is sitting right there. But we talked a little bit earlier about, well, where's the decision being made? Like if we need to invest in technology to change patient care or change the way our employees interact with one another, that decision to invest historically either happens in IT or it happens outside of IT, and they just look to folks like you and go, hey, make this happen. What Chris just described is much more collaborative. It's a little bit of a unicorn in business, but how do you feel about where decisions are being made for technology investments within Tribe and the role of your team, not just to deploy and execute, but as part of that decision-making process?
Yeah, it's a great question. And to be totally transparent, like my background is not in clinical IT or healthcare IT. I grew up, I did manufacturing IT. So I worked in a big plant facility for 2 or 3 years. Then I moved over and doing some more manufacturing. Then I moved over to government IT. So I worked for local county government for about 13 years, and then had an opportunity to jump over and help. So I had some frameworks with the local county IT on how we did things there, scale wise, as far as how this tribe was wanting to grow and get bigger, how to apply like what I knew on that scale and be able to help them grow and transition. But honestly, it has to be collaborative, because I'm more technically minded in an IT operations sense. I'm like, what are our day-to-day IT operational things that have to happen so we can deliver the services that the clinical team needs to be successful? But I also have to depend on the clinical team. We always have open lines of communication. Like I've got to get feedback from them on where they feel like they're missing or where they want to go next, so we can bridge the gap. Intentionally, I have made sure that if I've had the opportunity to pull somebody that's had an interest from the clinical team to work in IT or work in my informatics team, and I had the opportunity to train them up and do that, I've welcomed those opportunities, because those people are key to help me and my team from a technology side bridge the gap to a clinical world. And that's not always easy, because, you got targets that are trying to be hit from a clinical team to deliver good patient care, and how IT comes in and can either facilitate that or make that cumbersome is things that we got to be able to communicate effectively back and forth. So as far as where the decisions are made, if it's in an IT operational type thing, or if I see us growing in a way that is going to put limitations or barriers on how the clinical team has communicated that they would how they'd like to grow or operate on a day-to-day basis, then, I'm trying to put out proposals in front of them on, hey, this is where we need to grow on our infrastructure. This is where we need to grow on our software. This is how we need to change our licensing structure with, with Microsoft or with our EMR. So we're always looking at opportunities to do things differently, and I try to hold it very loosely, because the terms that I like to use, when we get compared to bigger systems, like, oh, why aren't you guys doing technology in this huge way that maybe a local hospital system's doing it? And my response is because we haven't had to grow through that yet. So we're still in a season of growth. Even though I've been here 7 years, every year has been steady, continual growth, whether that be adding more volume because we've opened up a practice that has, or new doors or new divisions that hasn't hit their volume potential yet, or they've hit their volume potential and they need to grow to be able to serve more patients that want to come see us. So we're always juggling those balls, but the answer is always, like, we're growing to where we want to be. We haven't existed as the same type, same type, but not the same size. We haven't existed as the same size company for very long, but it's always growing. So the goal is to make sure that we're have enough forward vision casting to be able to say, where do we need to have more growth, or where do we need to invest our money to make sure we don't hit a wall, or we fall off a cliff somewhere because we didn't plan the road far enough ahead of us. So
Hey, Kyle, I would just interject and say and challenge anybody. I mean, we try to do leadership differently as a whole at Tribe. That's a whole different webinar. But if I can't trust Josh to be a good steward of our resources and buy the necessities, and then I need somebody else in that job. He doesn't need me to micromanage him. And in return, that trust is returned. And when there's a big decision to make, hey, we need to spend $15,000, $30,000, whatever on, whatever that might be, and it's in his area, he calls either me or David Martin, our CEO, and it's usually that quick. And I would be shocked if Josh could come up with a time that David said, now hold on, Josh, I want you to walk me through the specifics of that. It's going to be, hey, do we need it? Trust you. Let's go.
Yeah. And there's a lot of those checks and balances that, being smaller and independent, we got to be more aware of. I don't have a blank check. I like that accountability because I know I need to have a good sounding board for how I'm spending our company money, because I could make being small, and especially during a time where, we got lower volumes because of a pandemic or whatever, I could make a mistake in purchasing. I could think that we need something right now that actually could be a detriment to, our company finances. So I always have to make sure, and it's not I know the trust is there for me to be able to do a good job in the tasks that I've been given, but I'm also very aware that I can make a mistake very easily in the environment that we operate under, just because of our scale. So I always try to make sure to just double check to say, hey, are we good? Can I pull the trigger on this? And, Chris is right. We hardly ever get any pushback or why we don't need anything, because I try to make sure that we've worked long enough now to build up trust to say, if I'm bringing something to the table on how we need to move forward, we're going to need it pretty soon.
Yeah, and that's so very tactfully answered, Josh. I set you up there, and you did a great job. And Chris, I think everybody on here is interested in you hosting the webinar on how to run a leadership team like this. Because I will promise you that one of the biggest things that I took out of that answer there was, to our business partners, if you're approaching a customer, you have to have both of these guys at the table. It can't just be one or the other. You got to have them both at the table. And I don't really care how big the company is. You two have clearly established a model where mutual decisions are being made both on the operations side and back office. So I thank you for that. Look, we've got just technically 60 seconds, but I'm going to steal some of my other time here because I want to get answers on a couple of things that I know have come up. So let's go rapid fire here. Josh and Chris, I do want to talk about EMR a little bit, but let me ask you these other two questions first, knowing that we got to save a little time for EMR. So wearables, sensors, at-home vital signs, specimens, etc., very topical right now. Are you guys doing anything in that space?
We're doing just a little bit. We're dabbling in it, and especially on our internal medicine side, we do some continuous glucose monitoring
Okay.
for our diabetic patients. We don't have a ton of that. I know there are integrations and stuff available with our EMR with some of the wearables, but on the patient care side, that's the one we've done the longest at this point.
Okay. And I'll let Josh expand on EMR here. Chris, one of the things that you mentioned when we first had our run through, and you talked about MSO and how how all these people go home and now they're working from home, and you made a comment that you guys are concerned about the mental health of your employee that's now stuck at home and working from home. Yes, we're on a webinar to talk about how to get those people back into the office, but we all know that that's not going to happen overnight like we did when we sent them home. But can you just give us a quick example on things you're doing to stay connected with the people that are now permanently working from home?
Yeah, and I'll be really quick. That's so important. I mean, one of the unspoken evils of this situation we're in is the impact that it's having on folks emotionally, spiritually, and even physically. Those things are all related. And like I said earlier, we're a company built on culture, and a huge part of that culture, we have 5 core commitments, and one of them is to live a life of fun and play. And a big part of that is the interactions that they have with one another at work. And when you take those away, and boy, gosh, I just want to praise, big ups to all the working moms out there who, the last couple months of the school year had to figure that out, maybe more so than dads did, but had to educate at home and try to keep their job and do their work and hit their deliverables. I mean, and we're venturing back into that now, right? Beginning this week and next week. So it's been really hard. And to your question, we've just been looking for ways to check in, not just from a productivity evaluation standpoint, but also like, I want to know how you're actually doing. I don't really care about the work. I want to know how you're doing, how you're feeling. So our CEO, through a leadership group that he's a part of, found a tool called 15-5. And that's a tool that the first question is, how are you feeling this week? And it's not how much work did you do this week? It's how are you feeling this week? And they get to rate them between 1 to 5. And then, so we ask for that every 2 weeks. And so I get that, and I get to see if one of my team members if they put a 2 out of 5 or a 3 out of 5, I'm going to probably pick up the phone and call them and say, hey, I don't really care about anything else that's on that list about the work. I want to know how you're doing and what can we do to support what you're going through. I think that's a really unspoken part, but really critical piece of making it through this remote work period.
Yeah, and I run, I have team members on here, so plug your ears, team members. I run a big contact center, and so we are very focused on productivity, and it is extremely difficult at this time to try to separate the care of the employee and if they're getting everything that they need at home from then turning around and trying to go, well, are you still being productive when you're at home? And I err on the side of the employee well-being. Like it's you guys have mentioned it already. We want to have the best and brightest working for us so that we can be successful.
Right.
And that means an extra level of care. All right, I'm going to sacrifice some of my time on this next slide. Sorry, marketing, because people are going to get the slide, and then I can hit these things rapid fire. But I can't let Josh go without talking about EMR for just a minute here. There's a question in the chat asking specifically around Epic and whether or not Epic is the EMR platform that you guys are using, but that may be fairly immaterial to the question. But because you are independent, a private practice, what does EMR look like to you? Do you have to subscribe to certain platforms? Are there regulations in place that you have to adhere to that are the same as the big hospital systems? And again, I ramble and I ask multi-part questions, but the topic here is not only what are you using, right? What are you using to maintain and update this data? And if we can do it in a short period of time, what are you doing to make sure that that data is secure?
Yeah, so there's really 2 big players in our community, and it's Epic and ECW. We've had talks with Epic on what it would look like to use their platform, but at our size, it's kind of cost prohibitive because they're driven on a model of like your volume, and so are we. So if we have to then utilize our volume to pay a bill that's based on volume, those two things, they clash pretty quickly. So
Yeah.
ECW has been a good fit, and we've always used the term of like, Epic is an Apache helicopter and ECW is the Toyota Camry, and it's doing a really good job for us right now. So as far as the platform goes, it is all in-house. We did have, when Parkside was all in-house, and when we stood up Rto, initially they were two separate systems. And then when we realized they were doing a lot of the same type of work, there's going to be the economy of scale. We needed to make sure we get as much volume as we can together that impacts our cost savings. So we put it all together. We brought it back in house because we had performance issues, connectivity issues with cloud. We had the ability to be able to do that. The technologies that they leverage to actually run the system is your SQL backend client. There's a client layer that's deployed. There's a lot of pieces to it, but there's really, I come from an environment when I worked at the county where we had 50 or 60 different applications depending on what departments was working on what goals. But for healthcare, we got 2 or 3 really critical applications. So we're able to be laser focused in on making sure those things are performing well. They're protected well. They're able to be recovered in a timely fashion if we have an issue. And to talk to your points about security, we're always looking at physical access to the assets. We're looking at the, how folks are accessing those resources with their technology, the exposure points of those servers. So we're looking at all of those things, and every day we're coming up with new recommendations, or we're finding new recommendations on how to lock it down even further. So almost to the point to where we become a nuisance of locking things down. Where it's like, well, I was able to do something yesterday and now it's not working. It's like, well, we had to apply some extra security. So let's talk about how to get, we're not trying to take away ability. We're trying to secure the system and then figure out a way to provide the same ability in a more secure way. So we're looking at all of those things. We're making sure we got the servers are replicated, then they're on redundant storage, they're backed up, the backups are replicated, the backups are taken offline. So we're trying to make sure we have all the key. And honestly, a lot of these things are just basic elements to making sure your data is protected and secure, as far as making sure you can recover it if you have an issue, whether that be hardware. I always want to lean towards the things that that are easier to, if it's a hardware issue, a network issue, and God forbid you have a malware issue to deal with. Not at our company, but I had been contracted a few years ago to help with a malware incident at another company in town, and it's brutal. It's a really hard thing. I mean, it makes you physically sick to have to deal with those types of things. So we're always trying to keep up on the latest recommendations from the government and different, high test and all those things that try to make sure that we're taking as many of those recommendations that we can, that's possible for us to put into play, and making sure we're doing that. As we continue to grow our technology, we're not able to hit some of those points because those are some of the things that we're not able to implement become our targets. And that's what's important. It's being aware that those things are out there for us to shoot towards as goals, and making sure that we're planning to do that as we grow.
Could not have done this without them. Each of these 3 has been part of a very engaging panel discussion we had about some of the trends and opportunities and challenges with returning to healthcare, whether that's a hospital or a clinic. So definitely encourage you guys to check that out. That panel discussion we posted on social, and then you can also check that out on our landing pages as well. So again, huge thank you to our supplier sponsors. And I also wanted to give a big thanks as well to Chris and Josh for their time. My family is a proud member of the Tribe 513 family. So our kids go to Parkside Pediatrics, and with my last son, I went to the breastfeeding center. So huge fan of what you guys are doing, and I can't thank you guys enough for that. And then if you haven't already, make sure that you attend the last session in our Go RTO series. So next week, so on Tuesday at 1 o'clock, we'll have a really engaging discussion around return to office. So if you're not in healthcare, you're not in education, you're a regular old business like ScanSource is, really great conversation that we'll be having next Tuesday with Kyle and then Jessica Howard, who's over our HR team, as well as Todd Graham, who's the VP of our IT operations. So we'll be talking to you guys about some things we've learned and some things that we've experienced as we kind of evaluate or return back to office. And I would love to have you guys join that session as well. And then the last slide here is just a little bit more about the next series that we'll be doing. And so we're doing a really great conversation coming up in our Power Hour series about sales strategy and customer engagement in the next normal. So if you're wanting to learn a little bit more about selling, engaging with your customers and things like that, two of our sales leads, Joel Douglas and Courtney Cox, will be leading that session. Highly encourage you guys to be on the lookout for the next session in our Power Hour series.